now with a health alert about the popularity of GLP-1 weight loss drugs in the U.S. A new study has found that the usage has increased 500% in recent years, meaning Americans have spent, get this, more than $70 billion on those medications. Medical correspondent Dr. Darien Sutton is here with what you need to know. The $70 billion got everybody kind of like, okay, all right. But Dr. Sutton, I know that the CDC just dropped a proposal for Medicare and Medicaid. So what do we need to know about that?
A lot of confusion, just to get right through to it. So the Centers for Medicaid and Medicare have recently said that they're not going to cover medication for weight loss. Now, this is a rejection from the prior Biden administration proposal that would have increased access and coverage. Now, Ginger, with that being said, there are still certain Medicare plans that do cover it if patients have other conditions, for example, obesity as well as diabetes or heart disease or sleep apnea. And as we've seen, certain companies have even made adjustments to provide that access. For example, Eli Lilly, the creator of Zepbound, Novo Nordisk, the creator of Ozempic, have made direct-to-consumer processes which offer these medications with a prescription at a discounted price. Still expensive. We're talking about $350 to $500 a month.
Wow. So what should people who are thinking about taking these medications ask themselves and ask their doctors?
Yeah, you know, Eva, we talked about this. I think number one is reframing how we look at obesity. We are long gone from the deep-seated belief that obesity is simple, that it's just diet and exercise. We now understand through data that it is so much more than that. It is a chronic, complex, often relapsing lifelong condition that can be due to a variety of factors. For example, your family history or genetics, certain medical conditions like PCOS, polycystic ovarian syndrome, that can disrupt hormones and increase weight gain, and even as an adverse effect of medication. So what should patients talk to their doctors about? I think number one, aside from understanding those causes, you look for other options. Obesity medications it includes a variety of medications other than just injectables, and you also want to talk to your doctor about what stable weight loss looks like. That's not the drastic cuts that we see online and on our For You pages. That's really just 4 to 8 pounds a month. Studies show that losing weight slowly, you're more likely to keep it off.
So when do people stop normally taking these medications?
Yeah, DeMarco, whenever prescribing a medication, I think the most important question to ask as a patient, and you know that I've talked to you about this as someone who's always in the doctor's office, is to make sure.
It's a good thing.
It's a good thing. You always got great questions. Is to make sure that you understand how to stop that medication, especially when talking about these injectable medications. You can suffer from withdrawal symptoms. For example, rapid weight gain, increased appetite. It can even disrupt your blood pressure, your blood sugar, and your cholesterol. So when stopping this medication, typically patients will taper down, decreasing the dose or alternate doses. But again, it is so important to talk to your provider about how best to stop that medication, how best to stop all medications.
Yeah, because people start looking good and then they want to keep going, but that's not a good idea.
So you do have to stop at some point.
You don't have to stop at some point, but if you do want to stop, you want to talk about tapering it down carefully. And remember that obesity is chronic, lifelong, often relapsing, so it requires constant intervention.
Okay, crucial context there. Thank you, Dr. Darien. You always make us smarter. We appreciate you.